Officials familiar with the plan said the Finance Ministry reduced planned funding because of other spending priorities and because of state governments' poor track record of spending the health budgets they've been allotted in the past. The Finance and Health Ministries did not respond to several requests for comment. The National Health Mission is one of the world's largest health programs and forms the backbone of public services in India. It provides everything from free drugs to immunization services to millions of rural poor. Prime Minister Narendra Modi's government has hiked federal funding for the overall health budget this year as part of a plan to improve care and meet a 2025 goal of raising health expenditure to 2.5% of GDP from the current percent. Non-communicable diseases. After focusing on maternal and child health for years, the program had planned to broaden its priorities to tackle the rising threat of non-communicable diseases, NCDs. Faced with the lower funding, the Health Ministry has reduced its 3-year allocation to tackle NCDs such as cancer and diabetes to $1.4 billion, close to half of the estimated need of $2.4 billion, the documents showed. The Lancet, a British medical journal, last week said NCDs caused a disease burden in India like never before. More than 60% of deaths in the country during 2016 were due to non-communicable diseases, up from about 38% in 1990, according to the publication. The cutbacks in NCDs spending are dangerous. This can potentially stall the NCD screening and management plan, said Uman C. Kurian, a health researcher at the New Delhi-based think tank Observer Research Foundation. India this year introduced free NCD screening for patients in 100 districts, with plans to eventually cover the country. Beyond non-communicable diseases, spending on strengthening the health system, such as improving district hospitals and patient transport services, will be an estimated $4.3 billion between 2017 to 20, a third lower than the ministry's request. Planned funding for immunization will be $2.9 billion versus $3.2 billion requested. The spending breakdown for different schemes will be finalized once the Health Ministry is allocated funding in India's annual budget. Health versus other priorities. Modi's government has taken steps to improve public health care, including a 27% budget hike this year to $7 billion, accompanied by cuts to prices of critical medical devices and drugs. Shumikar Ravi, a health expert at Brookings India, said Modi's government was also pursuing fundamental structural reforms to improve healthcare, such as the ranking of district hospitals and empowering state medical officers. However, critics say more needs to be done to address the underfunded and overburdened public health system. Some 900,000 children in India died before turning 5 in 2016, the highest in the world, The Lancet estimates. In March, health officials faced criticism from other government departments for the National Health Mission's inefficiencies and were asked to rework the renewal proposal for 2017 to 20 after they drew up spending estimates of $33 billion. The estimates were pared back because Modi's government has other priorities and because the Finance Ministry wants to control spending as it seeks to balance fiscal deficit targets while boosting growth, several government officials aware of the process said. It's about political priorities. You have programs on roads, on infrastructure, on ports, said one of the officials, speaking on the condition of anonymity. More than $1.4 billion in health budgets was unspent by states by 2015 to 16, India's federal auditor said earlier this year.